There we go. Okay. I'm also going to share my screen so that we can begin the presentation. And there we go. And my name is Scott Yeager. I am the outreach manager here at Pennie. I'd like to thank Representative Ryan Bizzarro for supporting us as a new agency here in Pennsylvania and as Pennsylvania's new health insurance exchange authority. I'd like to turn it over to Representative Bizzarro to say a few words. And if you would, during the presentation, please, if you have a question, you can mute yourself. But if you have a question, please don't hesitate to drop it in the chat for us, okay? Or if you'd like to unmute, you're welcome to do that as well. With that being said, I'd like to turn things over to Representative Bizzarro. Thank you so much again for hosting us today, Representative. Take it away.
All right, and thank you. Thank you. Hello and welcome to Pennie's Lunch and Learn. I'm Representative Ryan Bizzarro of Pennsylvania's 3rd Legislative District right here in Erie County. I'm also the House Policy Committee Chairman. The goal of today's session is to give Erie residents a better understanding of the Pennie system, how to apply, and what Pennie can do for them. Being in office for 8 years, I've seen many struggle with finding affordable health care, and I believe many constituents aren't aware of the state's programs that are available to help them. Pennie is Pennsylvania's self-sustaining health insurance marketplace aimed at getting Pennsylvanians the coverage they need. And I have to say, I've been a proud co-sponsor of the legislation and was one of the first people on the forefront to fight for this when it just began the legislative process. So I'm proud to see it where it is today. Today's informational session is going to clearly explain how Pennie can help you, whether to find insurance or financial assistance for your medical needs, regardless of your income. Today's presenter is Pennie's Executive Director, Zachary Sherman, who is focused on leading the state to bring streamlined system to hundreds of thousands of Pennsylvanians who need affordable coverage. Sherman has worked in health policy and research his entire career, most recently as Director of Health Source RI, which he played a critical role in since 2011. Thank you, Executive Director, for your time today, and I look forward to sharing ways to access the benefits Pennie provides. And a special thank you to Scott Yeager for coordinating today's learning session.
Well, thank you, Representative. Thank you again for hosting us and for the opportunity to spread the word about Pennie. As you mentioned, we're here at this Lunch and Learn to give an overview of what Pennie is, how people can get connected to coverage across the Commonwealth, and very importantly in Erie County, and to tell you a little bit about new opportunities that are available through Pennie as a result of the American Rescue Plan. So let's jump into it. I'll start at the top. The representative just mentioned the origin story. He was one of the original sponsors of the enabling legislation that created Pennie, and this was in July of 2019 when the governor signed it into law, and it came out of bipartisan legislation that made its way through both chambers of the General Assembly and was passed unanimously through both those chambers and signed into law by the governor. It was such I believe, a popular initiative because it was all about expanding access to coverage for Pennsylvanians, doing more for Pennsylvanians, and doing it at no additional cost. What came out of it was the creation of 2 programs, Pennie, the self-sustaining state-based marketplace that we are today, and an affordability program called Reinsurance, which was established for 2021 and effectively reduces the cost of health insurance in the individual market from what it would have been had we just stayed with healthcare.gov. These programs work hand in hand together, and as I mentioned, and as the representative mentioned, are self-sustaining. It costs us no more today to run and finance these programs than it did for what we would have paid for use of the federal marketplace healthcare.gov. So fast forward to today, and we are Pennie. We are the state's health insurance marketplace, and we launched last fall in November of 2020 with the goal of improving the accessibility and affordability of individual market health coverage for Pennsylvanians. We do this by being the official marketplace. We've replaced healthcare.gov If Pennsylvanians go to healthcare.gov today, they'll get redirected back to Pennie as soon as you type in your zip code. Similarly, if you give them a call, as soon as they figure out where you live, they're going to redirect you back to the Pennie call center. We are the home for high quality commercial affordable health insurance plans, and very importantly, the only source for the financial assistance available to reduce the cost of coverage and the cost of care. And very recently, that financial assistance has gone up and been expanded to those who previously could not access it. We'll talk a little bit more about that in a little bit. We aim to serve and help Pennsylvanians who don't have access to coverage through some other means. So, of course, the uninsured, but also those who don't have access through their jobs to employer-based coverage and make more money than from an eligibility standpoint than they in terms of being eligible for medical assistance or CHIP. It's people who make more money than what would make them eligible for those programs. So that said, we do operate a no wrong door policy where even if you come to us and apply for coverage and are eligible for medical assistance or CHIP, we can get you over to the Department of Human Services through our no wrong door policy to ensure you get connected to coverage over there. And in a lot of cases, that is no cost health coverage through the medical assistance program. We have a number of resources available to help people navigate the process. We know that applying for coverage and picking the right plan for your health needs for your budget, it can be overwhelming, it can be confusing, and a helping hand along the way goes a long way. So we are unbiased. We provide those resources. We have a dedicated call center team. We have a number of online self-service tools to help you navigate the application and filter the plan options by what's most important to you, whether it's your budget, monthly cost, total out-of-pocket cost for healthcare services in a bad year, whether or not the plan covers your prescription drugs or your specific providers or doctors. We can help you filter based on those factors. So you're really looking at plans tailored to your specific needs. And then lastly, we have a number of partnerships with community-based organizations, health centers, and licensed insurance professionals across the Commonwealth to give you access to in-person assistance through the process. If that's what you need, one-on-one assistance, we can get you the place where you schedule an appointment with assisters across the Commonwealth. We can also connect you to local insurance brokers in your area who can help you get enrolled and help you pick a plan that fits your needs. Next slide, please, Scott. Big question we get is, where do the uninsured live? And of course, the uninsured are a big target population for people we're trying to connect with to make sure that they know what they're eligible for so they can get enrolled in coverage. Across the Commonwealth, there's over 600,000 Pennsylvanians still uninsured. That number has been reduced considerably over the last decade or so, but there's still a lot of people out there that are uninsured, and we know very definitively that a lot of them are eligible for financial assistance to reduce the cost of coverage through Pennie, and we want to connect with them. So in the Erie County area, there's still over 12,000 people uninsured, and we're eager today and over time to get the information in the hands of those people so they can navigate the process, get connected to financial assistance, and ultimately get the protection and coverage they need to live healthy and happy lives. Another question is, when can I get covered through Pennie? When are the enrollment seasons? And generally speaking, we have an open season that runs once a year. It's called open enrollment. It runs from November through January 15th. It's for the upcoming plan year. And that's the time when you're uninsured, or if you're looking for an alternative coverage option, you go to Pennie and sign up for coverage. Outside of that, unless you experience some sort of qualifying life event, such as having a household change, having a baby, getting married, losing your coverage through your employer, moving to the state, moving from one part of another state. Those are all qualifying life events that make you eligible for special enrollment periods, which are 60-day periods to sign up for coverage outside of open enrollment. Normally, those are the 2 times to get enrolled through the marketplace through Pennie. As a result of the pandemic, as a result of the economic and public health implications of COVID-19, we've created another open season. It's called the COVID-19 enrollment period. It runs from now through August 15. What that means is you can come in today and get covered, and it's on a rolling basis. So if you sign up today in May, you can get covered for June 1 effective coverage. If you sign up in June, you can enroll for July coverage. And there's more financial savings available now today than there ever has been. So if you're uninsured, if you're looking for an affordable alternative option to what you currently have, now's the time to come in and get covered. And the steps are on the slide here, but create an account, apply for coverage. If you need assistance, we can provide it to you, and we can help you get to the right place and ultimately into a plan so you can have health insurance. Now I'm going to talk a little bit about how the recently enacted American Rescue Plan has created more opportunities and more savings through Pennie. The American Rescue Plan, also known as the COVID-19 Relief Package, was signed into law by President Biden in March of this year, and it increases the amount of financial assistance available to Pennsylvanians kind of across the board, and has the impact of making coverage even more affordable and improving access to care. There are a couple different health coverage impacts of the American Rescue Plan. I will focus on the 2 most directly related to Pennie. The first is the fact that it increases financial assistance available through Pennie in 2021, in this year, and in next year at every level of income. If you were previously receiving financial assistance, it's increased the amount of financial assistance you're eligible to receive. If you were ineligible previously based on income, meaning you made $51,000 a year or higher as an individual, or $105,000 a year or higher as a family of 4, you're now eligible for financial assistance. And this caps, and what this has done is it's capped the amount that you would pay in those income ranges towards the cost of the benchmark plan through Pennie at no more than 8.5% of your household income in a year. So if the cost of the plan is more than that, we will provide financial assistance to reduce that cost. And Scott, in a little bit, will walk us through real life scenarios of how that's playing out right now. The other benefit that's really directly related to Pennie is one specific to the unemployed and to those receiving unemployment insurance, unemployment compensation in 2021. So this is an opportunity available right now, and it's specific to this year. And what it effectively does is make anyone who is eligible or receiving unemployment insurance for at least 1 week in this year, it makes them eligible to receive the maximum amount of financial assistance we can provide to reduce the cost of coverage and care. So if you apply for coverage, or if you update your application through Pennie, there's a question where we ask you about this. If you say yes to it, we will then connect you with the amount, the maximum amount of financial assistance available through Pennie to make your coverage affordable. This, in some cases, makes the cost of your premium $0, and in other cases, it makes you eligible to enroll in plans that have deductibles of $0. So it's a really incredible benefit for the unemployed, those receiving unemployment insurance, and it's only available in this year. So this is just a timeline of really what I just talked through. Now is the time to sign up for coverage. If you sign up in May, you can enroll effective June 1. If you sign up in June, that's for July coverage. If you sign up in July, that's for August coverage. These savings are available that I've talked about in the application right now. For existing customers who are wondering if they're eligible to receive these enhanced financial savings, we are in the next couple of weeks going to rerun your accounts to connect those savings automatically to your account. So as long as your information is up to date and we have all of the appropriate permissions, we will make those updates automatically. Of course, if you're not sure, just give us a call or log into your account and take a look. Since we rolled out these new changes, the American Rescue Plan changes, a lot of people have already taken advantage of it. Over 45,000 Pennsylvanians have come in and enrolled new or updated their applications, and a full quarter of them, 25% of them, are now paying $0 a month for their monthly premium. 45% of them are paying less than $50 a month for their premium. So the savings are really significant, and the opportunity is right now to get connected to them. So now I'm going to hand it to Scott, who the representative already thanked. I will also thank for coordinating this effort, getting us all here to talk about this, and for generally being the most excited guy about Pennie that exists in this world. So Scott, please take it away.
All right. Thank you so much, Director Sherman. And again, thank you, Representative Bizzarro, for hosting us. To say that we have some exciting news to share with the residents of Northwestern Pennsylvania is an understatement. Pennie, as an exchange, Pennie's goal is always to provide affordable health insurance options to everyone in Pennsylvania who is, in need of getting protected and getting covered. Some of the scenarios that we have here will most definitely, show you what it means to be able to provide individuals with significant financial assistance as we move into these. The first example is of a gentleman who is from Philadelphia County. He makes about $19,000 a year. Prior to the American Rescue Plan, this individual would be paying about $66 a month for his health insurance, which is about $792 a year. For folks who, are on that type of an income, $792 a year that's significant. Because of the American Rescue Plan, this individual and others like him throughout the Commonwealth will be in a position where they can, through our second lowest cost silver plan, our benchmark plan, they can qualify for $0 per month in terms of their premium and save $792 a year. That's significant, especially when you consider the income level here. That's very impactful. But here's another scenario that I truthfully believe is one that we encounter quite frequently throughout the Commonwealth. There are individuals who may be retiring a little bit early. Okay. And when you do that, you may not have access directly to Medicare options, Medicare supplements, etc. So purchasing your health insurance on the individual marketplace can be expensive. If you take a look at the scenario here, you've got a couple. They make about $77,000 a year. Okay, but prior to the American Rescue Plan, this couple would have paid $2,400 basically a month in terms of their monthly premium for their health insurance. Because of the 8.5% cap that Director Sherman had mentioned, now their monthly premium drops from $2,400 to $550 a month. For a couple who are, again, on a fixed income heading into their retirement years, savings of almost $23,000 a year, that's life altering. That's the power of the American Rescue Plan. And again, it's at its heart, it's about helping people get protected. Here's a scenario that could very well, it's in Potter County right now, but it could very well be in Crawford County. You've got a family of four who's making $52,400 a year, and prior to the American Rescue Plan, this family would have paid $285 a month for their health insurance coverage. Now, under the American Rescue Plan, again, this is with our second lowest cost silver plan, our benchmark plan, their costs are reduced to $87 a month. That's just a little over $20 per person each month. You can equate that maybe to, a trip to McDonald's. Okay. A couple times a week, but still a trip to McDonald's for this family each month, $87 to protect four people. That's fantastic. The last and probably the most universal in this day and age scenario is of an individual. She's 30 years old. She's from Lackawanna County. She makes about $51,000 a year. She would normally be on that bubble with regard to the subsidy cliff that you heard Director Sherman mention a little earlier, but she's also unemployed. COVID-19 has impacted a lot of individuals, a lot of small businesses, a lot of sole proprietors, and a lot of small precision manufacturers. It is incredibly important to know that Pennie, not only are we here to work with those individuals, because it's important that people who are workers in transition, or if they're transitioning into or from small business markets, to know that Pennie's here to help them and to help them get protected. In this scenario, she would have paid $364 a month prior to the American Rescue Plan. Now, again, with our second lowest cost silver plan, our benchmark plan, she qualifies for $0 a month, saving $4,300 a year. When you're unemployed, $4,300 that's a lot of money. That's that much more that you have with, to work with to help you, weather the storm, so to speak. And speaking of weathering the storm, you are never, as a customer at Pennie, you are never alone. Health insurance, generally speaking, health insurance can be an intimidating topic. In working with individuals across the Commonwealth of Pennsylvania, when you bring up the discussion of health insurance, sometimes people look at you like you've given them a glass of lemonade without the aid part. You run into situations where sometimes people cock their head, and it's because there's so many misconceptions. There's so many myths. There's so many apprehensions about health insurance, and Pennie is here to help with all of that. We know people have questions, but first and foremost, you can have the best health insurance on the planet. You can have the best health insurance products ever introduced to the market, but if people cannot afford them, you've got a boat on dry land. Okay. So I'd like to remind everyone that Pennie is the only source for financial assistance in Pennsylvania's individual health insurance market. That's significant because we get asked questions a lot about, well, what's the difference between shopping for insurance at Pennie or, going directly to UPMC or Highmark or Geisinger or Capital Blue Cross or Independence Blue Cross. Well, the difference is we have financial assistance that can help lower the cost of coverage and care. And to be quite honest with you, that comes in a couple forms. It's advanced premium tax credits and cost sharing reductions. The cost sharing reductions are always utilized with our silver plans here at Pennie. We have 3 different metal tiers. We have bronze, we have silver, and we have gold. That brings me to my next point. People hear the term financial assistance and they think, well, is it reduced in its quality in terms of the insurance itself? The answer is emphatically no. We align with the Affordable Care Act and the 10 minimum essential benefits that are brought forth in terms of quality health insurance. First and foremost, emergency services, prescription services, lab services, rehab services. That's important for a lot of folks. Maternity and newborn care. That, again, is very important to a lot of folks. Another factor that is infinitely important to individuals who are in workforce transition, who might be losing their employer-sponsored coverage, is being able to qualify for plans uh, where you can't be denied coverage due to a pre-existing condition. For small business owners, for small precision manufacturers, for individuals transitioning from one place to the next in a workforce, that's significantly important. Also, individuals who are under 26 years of age, they can remain on their parent or guardian's plan through Pennie. In terms of health and dental, and yes, we do sell health and dental insurance at Pennie. We get the question often: can you just buy dental insurance if you already have employer sponsored or some form of health insurance? Sure, you can. Okay, we will sell dental insurance as a standalone product here at Pennie, but please note that we don't, again, sell junk insurance plans. We work with UPMC, we work with Highmark, we work with Geisinger, we work with the 800-pound gorillas to help make sure that people get protected. I mentioned a little bit earlier, and Director Sherman had mentioned this as well, that we have 3 different layers of customer service. Well, technically 4. Pennie.com is our website. You can refer a friend, a neighbor, you can refer a colleague, you can refer anyone to Pennie.com. Our website is meant to be accessible. It's meant to be educational. It's meant to be a site where people, as people, customers, are in the driver's seat from day one, moment one. Okay. But again, we understand that nobody is born with an inherent knowledge of health insurance. It just doesn't work that way. So we do have 3 layers of support available at Pennie. First and foremost is our customer service center. Our customer service representatives at Pennie do not work for insurance companies. They work for you as a resident of the Commonwealth of Pennsylvania. They are here to provide no hassle, unbiased advice and education and guidance in terms of health insurance and health insurance products. They can help you determine whether or not you qualify for financial assistance. And once they do help you with that, they can also help you get connected with the coverage and plans that are right for you. Again, free of charge. There is no charge for that. We also provide local boots on the ground assistance, and that's done through our Pennie certified assisters who work with and through community health centers, as well as faith-based organizations. In some cases, they work within hospitals. So they provide, again, unbiased education and guidance for customers who need help getting connected with protection. Our last but certainly not least level of customer service here at Pennie are through Pennie certified brokers. We have thousands of Pennie certified brokers across the Commonwealth of Pennsylvania, and they are the licensed professionals in the Commonwealth of Pennsylvania that can actually advocate on behalf and broker on behalf of customers. Being able to connect somebody who may have a pre-existing condition or who may have very complex medical needs and health needs, helping them connect with the plan that is absolutely the best option for them, for their quality of life, and for their family. Again, all of these services are free of charge. The only thing that'll ever cost you at Pennie is your binder payment for your insurance. Also inherent with Pennie, and we mentioned this, is we are very new. We are heading into June, and June will be our 7th month of existence. We launched our exchange here in Pennsylvania on November 1st of 2020. And as Director Sherman mentioned, we have our COVID 19 enrollment period that will be open until August 15th of 2021. If you know of somebody who needs insurance, if you know of somebody who's between jobs, if you know of an individual who is really racking their brain on whether or not they have, a quality health insurance option, we have a no wrong door policy at Pennie. So you can always recommend and refer people to pennie.com. You can refer them to our customer service center. Again, the number is 844-844-8040. We're open from 8 a.m. until 6 p.m. in the evening, Monday through Friday. We also have social media. You can connect with Pennie on Facebook, on Twitter. You can also stay abreast of activities through our newsroom. Any significant news that's coming out about our health insurance exchange will always come out by way of our newsroom. And of course, any community partner is welcome to join our outreach and education work group. That work group it meets on the first Wednesday of every month at 2 p.m. in the afternoon. And again, we welcome contacts throughout communities in Pennsylvania to come and participate and provide us with the guidance and the insight that we need to truly make Pennie the health insurance exchange that Pennsylvania deserves. It's through collaboration and cooperation with our community partners that we gain the most in terms of perfecting what we do on a daily basis. With that being said, I'd like to open it up for questions. If you do have questions, please feel free to drop a question in the chat, or you can unmute yourself and ask your question directly. But again, thank you so much, Representative Bizzarro, and thank you to your staff for helping us bring this together. And with that being said, does anybody have any questions for us?
Gentlemen, I think you guys were both so good and so thorough that you left everybody speechless. There are no questions about this incredibly complicated process, but that you have all managed to simplify, and you do such a great job of that. Many people might be a little stage fright or digitally frightened. We'll say that they don't want to speak up, but certainly if there's anybody on this who has any questions, please feel free to contact my office or contact any of the folks who presented here today, and we'll make sure that we get you the answers that you need.
Absolutely. And our contact information again is right here. You can contact us at 844-844-8040, or you can reach out at pennie.com. We're always available. And with that being said, Representative Bizzarro, thank you again so very, very much. Thank you to everyone. I am going to stop the recording here, and I will wish everyone a very safe and productive holiday.